Lakeland Currents, your public affairs program for North Central Minnesota. Closed captioning is made possible by Bemidji Regional Airport, serving the region with daily flights to Minneapolis-St. Paul International Airport. More information available at bemidjiairport.org.
Hello again, everyone, and welcome to Lakeland Currents. I'm Ray Gildow. Talking today with Tim Rice, who is the President and Chief Executive Officer of the Lakewood Health System. Tim has been on our show before, but it's been quite a while ago since you were here, Tim, and a lot of things have happened since then. And so we're going to talk a little bit today about Lakewood Health System, what's happening there, and maybe a little bit about where Tim sees the future of healthcare going. And the reason it's important is that this is his last month. He's retiring as the main guy, although you wouldn't say that because you've got teams and you're a very team-oriented person. But welcome back to Lakeland. And welcome back, I should say, to Currents. It's nice to have you here. And tell us just a little bit about the organization of Lakewood Health. How many clinics you have and where are they located?
Well, again, it's thanks, Ray. It's really fun to be back. It's maybe a really nice way to end the career as I get to be with you on this show. So this is
that's a highlight.
A highlight of my career. So thank you for that opportunity. Boy, Lakewood sure has grown over the years. Again, I've been there 42, but as of right now, we have our main campus in Staples, and then with the hospital there, and then we do have our main clinic is there, but we also have clinics in Pillager, Motley, Browerville, and Eagle Bend. We actually have a derm clinic in Sartell as well.
What kind of clinic?
A derm clinic, dermatology clinic.
Oh, dermatology.
Yeah.
Okay.
So we have that in Sartell, and I've had that for a number of years. And those dermatologists, there's two of them, work there and up at Lakewood. But we really do have a full continuum too of care. We also have the care center, and then we have two different assisted living or independent senior units in Staples. We also have, the home care hospice, the ambulance, durable medical equipment, medical transportation. So really we do offer that full continuum. I think the key thing about organization is, I know when we started we had 4, maybe even down to 2 physicians, and that really were living here, part of this group, and right now we have over 50.
Wow.
Yeah, so that's a key element of Lakewood, is just having that level and number of providers that are part of Lakewood and in our organization.
Probably a tough question, but what are some of the awards that your organization have won over the last 4 or 5 years, if you can remember them?
I think the key awards is we've got a number of awards on quality, and I think just from health plans and others on the quality that we provide. And I think that's probably our number one priority and goal all the time, is quality, safe care, and to be recognized for those efforts. Our care center just received an award, but they're in the top 5% in the state and also in the nation as far as different ratings. And a lot of this information is available publicly, so.
Sure.
But I would say the quality and the results of that, both on the senior services side and the hospital side, I think have been what we've been most proud of.
As an outsider looking in, the thing that's always amazed me is not only do you attract a lot of new people, they stay. Some places have people come and go and they don't stay around long, but you have a culture where people make a commitment, and it seems like they stay in that organization.
Yeah, I think there's a couple elements. If you take on the physician assistant, nurse practitioner side, I think it's that medical group as a whole. It's how do they welcome each other? How do they support each other? And we have a lot of RPAP and medical students. They do a lot of teaching.
What is RPAP?
The rural physician program where medical students can come and practice here from medical school, and they can spend time here. And our physicians do so much on training education. We have students medical students in different types and specialties in the building all the time. And I think those kind of things and how they encourage them to really provide great interaction with them about their practice, it creates this relationships and awareness about, hey, I would like to work there. So I think our physicians' commitment to teaching really helps draw people to, so you're getting people who really have already experienced this, so then they want to come and stay. And as far as employees, right now we have like 850. I think when we started we had 250 or whatever.
Wow,
but
that's quite a growth.
I know that's quite a change. But there is just, you try to develop a culture, where people have a voice, and that you're there for that vision of exceptional quality and care, and you develop a culture where they can feel comfortable doing that work and having a voice. And
I'm amazed when I walk through the parking lot and see the licenses and from the communities that people are coming from. It's really incredible. And I know that you have a department that delivers a lot of babies. And I don't know how many babies are delivered a year there, but
it's about 500.
500 babies, which is amazing for a town or the area the size of ours.
It is.
We're really blessed, I think, from Crosby to Perham, Aiken to have some really good hospitals through this whole corridor. We're very, very lucky. But I know you've got some brand new things you're working on. What are some of those?
Well, I think I want to get to that, but we should mention about having these great facilities. I've always had a personal belief, you would want everybody around you, as far as even who you may be perceived to compete with, to be great. And I kind of always use this analogy. If your child is driving somewhere and let's say they get hurt, you wouldn't want any place around here, if that's where they are, not to have an exceptional facility. So that's always something I've been proud of, is our area has exceptional medical care, and something we should all be really proud of. But we have a lot of great healthcare organization around us, and I think that is just wonderful.
I do too. That's right.
It's critical.
You talk to people in other parts of Minnesota even, they have to go 70 miles to a hospital or to a clinic, and we're so fortunate here to be able to be close, to have some really great facilities. So what are some of the new things that are happening with you guys?
Right now we're working on, we just did groundbreaking on we call it the Plaza. And it's a construction of a 17,000 square foot building. It's right by, in Staples, right on the highway, by Ernie's, right across from the Dairy Queen and the Timber Lake Hotel. And what that is, it's we partnered a year ago with Twin City Orthopedics, and that provides us. We actually have an orthopedic surgeon 7 days a week in the community, and it allows us to expand our surgical and fracture care. But with them, they want to work on developing a sports performance and enhancement center. So that's the main tenant in this building.
Wow.
So they're going to be, so TCO is the main anchor.
And that's the organization that works with the Vikings.
Correct. Yep. And other professional sports. So so it's kind of fun to watching the game, and all of a sudden you see your TCO, the very same group that's coming up here, is identified on TV. And and so but also when we designed that anchor tenant, we also looked at, we do have a role in economic development. So we've got 4 retail spaces in that building. And we do have, we're working with one potential tenant now. We've been working with them. It's still not finalized yet. And then there are 2 or 3 other spaces that could be leased. And so we're working to see if anybody locally would like to utilize that space. If not, by the time we get done, it should be done by, we just broke ground, it should be completed by end of next year. But then we'd go to if there's somebody from outside the community that wanted to lease that space. But on the top of that building is 11,000 square feet. It's it's about 13,000 500 square feet, 11 apartments.
Wow.
And I go visit my daughter in LA, and it's kind of interesting. A lot of the apartment buildings there have retail space below and apartments above.
Really?
Yeah, it's quite common. And so, but anyway, we've designed this so because we also know housing is a concern, and we also have medical students, we have others where we need places to stay, but we know housing is a critical issue. And then we got a patio on the top. Where,
oh, really?
And
outdoors?
Yes. So we're Minnesotans. We'll use it year round. But
you can go up there in January, but I'm not.
Yeah. But no, but even on Kelsey's apartment, the whole upper level is just a whole area where you can go and read. And
so who are these apartments being designed for?
oh, that would be for the public. Anybody could rent.
Really?
Yep.
So it'll be 4 more, or not 4, but did you say 11? 11 more places to rent out into the community. Because I know Staples is not unusual, and a lot of our small communities have no place for people to live.
Correct.
So that's a real need that's going to be addressed, isn't it?
Yeah, the city of Staples has really done a lot now in the EDA over this last couple of years. There's been a lot of other apartment buildings and other housing developments. There's a lot going on with it, but there's just more needs to be done, and so we're all trying to work on that aspect of the need for housing.
How old is your main campus? How long have you been there now?
2006.
2006.
When that was built.
Wow. And you're constantly making changes, and I know one of the changes that you've made is to add an oncology department.
Yes.
With a new oncologist. You want to share a little bit about that?
Yeah, we're so excited about Dr. David Swenson and also a nurse practitioner, Alyssa Manning. They are the ability to attract and to have access to oncology care in rural areas is a real issue. And I think some of the statistics are that like 60% of the counties in the country don't even have access to oncology or cancer care.
I can believe that.
It's incredible. We are so fortunate, that Dr. Swenson has joined us. He's already started.
And he's a fairly young person, not that age should be an issue here, but he's going to bring a whole different perspective, I think, to that department.
Yeah, it's interesting, the older I get, how everybody seems young.
Me too, yeah, absolutely.
And, but yeah, and I think it's a good culture fit. I know he was really interested in Lakewood and who we are and our culture, but we're just excited about what are the really working with him as far as improving that access and stability of having oncology care. He also has dreams or visions. One of his, he just finished his, I think it's his master's from college on business.
Mm-hmm.
And
really?
Yeah, and he just, I think, graduated he went back and got an MBA. And he has a real interest about and concern about oncology care in rural areas. And one of his goals, he wants to work with us about how do we expand to ensure we have increased access to oncology to this whole rural area. So it's just not Staples that he would like to look at, but how can we work collaboratively with others and really focus on addressing that issue? And so his visions are more just he's just wonderful with patients. But he's got a broader vision, and it's going to be fun working with him to see what we can do with that.
That's got to be a pretty rare combination of degrees.
Yes.
Having and being an oncologist and also getting a business degree. That's very unusual, I would think.
Yeah, it is.
Yeah.
But he's just going to bring so much. But we are, we're just so pleased to have him available, and to be able to offer that in this area is just so critical. And
I know. I'm a patient at the University of Minnesota too. And even there's a big turnover in the oncology department. There's such a demand nationally for these people if they have expertise and are really good. So I think it's just amazing that you've landed a full-time oncologist. on that Staples campus. That's some really good work. Good for you guys.
Yeah, thank you.
And you're going through a transition now. You're in your last month, I would guess.
Right.
December. And who's taking your place?
Very proud to announce Lisa Bjerga will be the new CEO effective January 1st. Just some background on her, but it's really this process started, our board, they really had a lot of foresight in all this. I'm trying to remember, 5-6 years ago, they identified if anybody internally, by the way, she was our CFO.
Okay.
So she was within the organization. But many years ago, they did assessments and identified anybody might be interested. And then they provided those individuals internally opportunities to grow. And so like some of the things Lisa have done already, she's already worked with Magic Forest about doubling the size for daycare in the town. She's working collaboratively with others about housing, building homes. And she also worked with a board committee in the school about if the school, when they remodel, we would put in a walking track. And you know, if you take a look at where do we have access to that, and we have people rehabbing from hip and knee replacements, where do they go to walk during the winter and those kind of things? So those are all some things that Lisa all developed and worked on, you know, while she was working in her development for the position.
Okay.
And then I had to give a 2-year notice, and then Lisa applied, and then there was internal, external applicants, and she was able to, she was received the, was hired by the board. As the CFO though, she came here in other roles, and she's been here like over 8 years, but she did some national leading work in revenue cycle and other work, and then worked her way into the CFO position. She developed a great fiscal team, and so that positioned us really well. And so she's really done a lot of things up to this point. So we're really excited about her. She's a known commodity. Internally, people trust her. I think that's the biggest thing. People really trust her, and I'm just really excited to have her.
I know a number of doctors, of course, living in Staples, and they all speak so highly of her. I mean, it's universal. I've just heard wonderful things about her vision. Unusual for a person coming from the finance department to have that broader vision, because we think of people in finance usually as, you know, focusing down on the minute little details. Doesn't seem to be the issue with her at all.
Well, then I'll throw a little twist in this. Actually, my degree was in finance.
Was it?
Uh-huh.
So that's
So
one of your own.
Yeah, it's one of their own. But no,
Wow.
I went to school for accounting and finance, and I wanted to be a CPA, and I never got to it. But maybe it's not too late.
It's good. It's good for you. So, tell me a little bit about the hospital has such a broad interest in the communities.
Yeah.
You're talking about Eagle Bend, Pillager, or wherever you're at. You really have a philosophy about the importance of healthy communities make healthy hospitals,
Right.
don't you? I mean, that's really your philosophy to some degree.
Yeah, it is. I think what the philosophy is that you can be a hospital and clinic, offer different services, but they've identified that only 20% of a person's health can be addressed from what we can do inside our walls. But 80% can be how do you work on all the other aspects about what's in your community. You know, personal, just healthy living, personal choices, nutrition, having places to, socialization, all those things. So I've always had the belief, why would we be a healthcare organization and only focus on 20% of people's health? Why not 100%?
That's really interesting.
So that's kind of what our vision has been. And, you know, our goal has been, we want to focus on 100% of people's health.
Cool.
And that creates a healthy community.
Yeah. We're already down to 7 minutes, and we haven't even talked about future trends. What's happening? I know our country is aging. I just read where there's going to be millions of students less in our elementary schools nationally as our populations are dwindling down. What are you seeing in your healthcare trends?
Well, I think I think you just identified the shortage of workers. I think is going to be a significant concern. How do you get people interested in health careers? You look at all the opportunities these days. So I think that's going to be a big challenge for us is with all aging people, increased demand and growth, how do you find enough people to handle all that work and demand? So I think just working on that standpoint is going to be big. Maybe just some, I think other trends, I definitely think we have a lot of concern with mental health. I think there needs to be more support for mental health. I mean, even now, if you look in our emergency room, we actually have times where we have what we call boarders. We have people coming in, there's no bed for them, and we're actually keeping them for weeks or even sometimes over a month. We have a patient comes into the ER and we have to keep them there. And
I've heard that from other hospitals.
right, and so, I mean, that's sure not the best place for them, and we're still taking care of them, but it's not getting the care that they need. So this whole need to help, just focusing on mental health services, mental health beds, I think is going to be a critical issue that we got to work on. I think the other one is just technology. We have it's always amazing. The new technology comes out, new medicines, with electronic medical record, but I have a big concern for rural areas and the lack of, access to, high-speed internet. So if you think about it, a lot of healthcare now can be done virtually, and if we don't have that available out here, and we got older people living out here, lower incomes, lack of transportation, so it's putting them at a disadvantage. And so to me, if we're going to be in fairness to rural people, we got to focus on access to high-speed internet in the rural parts of the country.
It's amazing to me how many areas in Minnesota don't have high-speed internet.
Right.
They were talking about the South, how it's infecting the farming community, where they're relying on technology for their planting of fields and everything, and they don't have internet. That's amazing. We're down to our last few minutes here, Tim, but who is Tim E?
So, talking about technology, we expanded our lab and put the lab downstairs, but that created a greater space between lab and surgery in the ER. So Tim E is a robot.
Named after you.
Yeah, the employee did
it's Tim.E.
Yeah, like Wally.
Yes.
The employees did a contest, and the highest votes was Tim E. So that's quite an honor.
I guess.
So, but what it does, it just is able to go up to the ER and to surgery, get specimens secure, bring them back, and that's incredible technology.
And I've read in the paper this week where it's already put on 1,000 miles since I think you got it last summer.
Yeah.
And it goes on it can go out to the outdoor ambulance service area.
Yep.
And it can deliver medicine.
Itself can go to the elevator, take it up to the right floor.
And it's got Viking horns.
Yeah, we put, our employees are also very creative. I love it. They got the horns with the braids for the Vikings on skull sign on it.
That's very cool.
Yeah, it is.
So, the aging population, how do you see that affecting the hospital care industry? Because right now you see explosion in the new hospitals, new facilities. As the population ages and these people start leaving us, how do you see that affecting the hospitals that are here?
We have been seeing more people moving to rural areas, though. So are you more of the concern, if people are leaving and will we?
No, I think just talking in general.
Talking in general. The technology has also helped, from that standpoint. But we sure are seeing more people moving to the area. So I think for overall, as far as total population, but I think as far as the people and aging though too, we are seeing people living longer. And I think that's why we like having our full continuum of services. With that range, we can adapt and adjust to what those different needs are. You know, whether it be more on the clinic or senior services side. And that's something we're continually evaluating is how in our full continuum do we care for people? And it's something we're continually studying, and strategically that will be the fun things that Lakewood gets to work on going forward.
You really can't rest on your laurels, can you, for what you've done?
No.
Because the world is changing so fast, and the virus obviously changed so many things for so many of us.
Yep.
That you can go down to, you can go snowmobiling in Yellowstone, stop in and pop on your monitor and do a Zoom meeting with your doctor.
Yeah,
if you need
it's
to.
incredible.
It is really amazing.
Well, I think with all that, the future there, I think that's where we're excited where Lisa comes in. We got great confidence in her, and that'll be all the different things that she'll be working on with all of our employees, teams, and providers. But it's in great hands with all of them, and I'm excited.
When
for
did you say you plan to have your new plaza open?
I think it was the end of next year, end of 23, when that's done.
So there won't be any activity in there until probably a year from December.
I would say.
Okay, all right. Well, Tim, you've done a great job, and I've known you for all those years you've been in Staples, and you're going to be hard to replace, but it sounds like they've got a person that's going to do a great job.
Yep.
Work well done, and I wish you the very best and the best of health as you go into your new venture of retirement. And I'm knowing you, I don't think you're going to be totally retired, but you'll be doing new things.
Yep.
Thanks for jumping on with us. Appreciate it very much.
Yeah. Thanks for having me today.
You bet. You've been watching Lakeland Currents, where we're talking about the things that you are talking about. I'm Ray Gildow. So long until next time.